hope you're having a great day. My name is Clark, host of Intelligent Beauty. Today, let's talk about the lower face and rejuvenation. So rejuvenating the lower face comes at a price. It's not the easiest thing to do, and there are very few products that can make these lines go away, that can raise the lips up on the corners, that can remove the dimpling in the chin, or commercials that can just lift the skin, remove the jowls, give you a nice jawline. There are very few products that can do that outside of surgical procedures. Let's talk non-surgical procedures. So non-surgical procedures are Botox, Dysport, Xeomin, fillers such as Restylane, Belotero, Radius, or Juvederm, Sculptra. So these are procedures that can elevate and lift the skin. There's also a very popular treatment called threads. So threads are basically using surgical threads that are typically used for regular surgery when we're closing to lift the tissue, the skin, the fatty layers up and really help to contour the face, lower face, and the neck. Today we're talking about Botox. Botox is very, very interesting. It's a drug that relaxes the muscles without giving you too much of a relaxed look if it's done well. So with the lower face, there's more complications and more risk involved if you are injecting the face from the eyes down using a botulinum product such as Botox, Dysport, and Xeomin. One of the issues we come across is there's so many muscles in the lower face and they're so close together that if the Botox is not done well, we will inadvertently relax those other muscles, which can change your smile, or in a severe case can give you a drool or a droop on one side of the face, which may look as though you have a stroke. But if you're in good hands with a very experienced clinician, you will not have these issues, no fear. So lower face rejuvenation with Botox is amazing. What are some of the most common areas that can be done with Botox in the lower face? It's that gummy smile. When we smile and the teeth are showing prominently, we can relax the upper lip so that gummy smile doesn't appear as often. We can also turn the corners of the lips up by treating the DAO muscles. We can remove the dimpling in the chin by treating the mentalis muscles. Also, we have the jowls and we have those lines in the neck. What are those lines? But those lines correspond to the prominence of the platysmal band, which is a broad, flat muscle that runs under the jawline into the neck. And when this muscle pulls, it can create these lines that gives us an aged appearance. So using Botox to relax those muscles can give us more of a chiseled jawline if done well and if it's the right candidate for that product. One other use for Botox is on the upper lips to reduce some of those smokers' lines or those upper lip creases that we find after the age of maybe 30 or 40. Many uses for Botox. Typically, I find in the Asian communities or anyone with a very full jawline, we can reduce the muscle mass on the masseter muscles to give a more slender shape to the face. So all of these areas in the face can be treated with Botox. But again, there's a lot more risk involved. There's a lot more downtime sometimes. And if the clinician is not experienced enough, you will have a very bad 3 months. Botox in itself is not a bad drug. It's how you use it. Botox is just a tool. So the clinician has a lot to do with your results, how you look, how you feel. Make sure you have a very experienced clinician who understands and knows what they're talking about and can translate that information to you. So Botox in the lower face is not an FDA approved procedure. It's a common procedure done throughout the world, but it's not FDA approved in the United States. However, it is done on a regular basis. So that's it on Botox and rejuvenating the lower face. I hope I've answered some of your questions. Don't forget to subscribe, click on that notification bell so you can get updated videos on all things beautiful.